we had these huge amounts of rain, and we had huge landslides from the hills with big stones and huge trees being rooted up and then carried down by the water into rivers and blocking the river passages, which ended up that because the river passages were blocked, the water spilled into houses and other farming lands and all the other places because it did not have any other way to make out.
This is the mark on the flood on 2009. On up here on 2010. For this year, the level of the flood up here.
The aftermath of a disaster is a rise in malnutrition among children. So we have had a lot of discussion about malnutrition among our children since last year, because we saw that we have had a lot of admissions because of malnutrition as a primary diagnosis in hospitals.
The major factor that's causing the malnutrition problem here in Fiji is basically poverty. Poor knowledge of parents, and also the way they prepare the feeds for the kids. Ever since our vitamin program has been implemented in our hospital, I've seen a remarkable progress in the rate of malnutrition cases, and I think it's helping them a lot. Yes.
When they prepare vitamin, it's to provide children with the meal. Basically that's the reason, and also to get them acquired to the taste and to the ways. The mothers are also staying in with the children, so they get to see how to cook and how it is done, and when they see that the children are accepting it, they're eating it, they are more motivated to go and do the same thing at home.
Particular girl, a Fijian girl, she's about 7 years old, and with malnutrition, so we put her own vitamin program, and before, when she came in, her appetite was really low, but now the appetite is there, and she's gaining a lot of weight. Yeah.
Thank you. For the children who are malnourished, when they come to clinics, they come for the normal maternal and child health clinics, from where the nurses screen them, and if they find that they are underweight, then they are referred to the dietitian's clinic. The dietitian assesses the child, and then the dietitian takes over in terms of advising the mother.
We just advise them on the feeding, and also we do food demonstration to them and show them like what kind of food they should be feeding their children when they come to the clinic.
One of the key messages in that training is that we need to give our children lentils and beans and legumes and rice, and that fits perfectly with our vitamin product that we are giving to our children, because that's what it is made of. Coming down to the community level, where we have the dietitian's clinic, all the children who are referred to the dietitian's clinic are either first, second or third degree underweight. So in terms of assessments done to these children, the heights, the weights and the ages are taken. We go to the communities with something to give them, then they are more ready to come and sit and listen and talk to us. For all the children who are on dietitian's clinics, go home with a packet of vitamin as a supplement to their diet.
On behalf of our Fijian community, I would like to thank Nuskin Distributors for donating vitamins to our community.
I think that Vitamil is doing a wonderful job to our babies here, and it's helping them to grow healthy, I believe, and it's also helping the parents to kind of bring up their child in a more healthy and nutritious way. Yes,
it's a great product, and I think it's working well for Fiji. So thank you very much.